Hey guys, welcome to my YouTube channel Topper Medico. Today's video number 1 and let's learn about osteoarthritis. What is meant by osteoarthritis or the definition of osteoarthritis? It is a degenerative joint disease which causes wear and tear of joints as one ages. What would be the probable causes of osteoarthritis? It is usually multifactorial. What are the types of osteoarthritis? It is primary or secondary. Primary occurs in old age usually and common in knee and hip joint. Secondary can be due to various predisposing factors like obesity, previous diseases, congenital, and avascular necrosis and coxa vara in hips, and it is also most common in hips. What would be the pathogenesis of osteoarthritis? It is a degenerative condition which affects the articular cartilage, and due to repeated weight bearing it causes fibrillation, and for further rubbing it causes osteophytes formation, and which leads to the formation of subchondral cysts and sclerosis, which leads to the synovial inflammation, which further causes deformity and stiffness of joint finally. The deformity usually will be genu varum. An additional point is, in India, the most commonly affected joint is knee due to cross-legging position, and in Western countries, the most commonly affected joint is hip due to squatting position. What are the signs and symptoms of osteoarthritis? The usual symptoms are pain, swelling, stiffness, and tenderness, a feeling of locking and restriction of movements, difficulty in climbing stairs, often told by the patients, and wasting of quadriceps. On examination, antalgic gait will be positive, patellar tap will be positive. We can notice a genu varix deformity. On examination, we can also find tenderness and crepitus as told before. Additional point is usually unilateral joint involvement, that is one side of the leg will be affected in osteoarthritis, and later on both legs can be affected. But in rheumatoid arthritis both the legs will be affected usually. Next, going on to the investigation. The investigation of choice would be X-ray, and the characteristic findings on X-ray is narrowing of joint space, subchondral cyst and sclerosis, osteophyte formation and loose bodies, deformity of joint. We can also go for the further investigations like CT or MRI. Coming on to the treatment, how do you treat a patient with osteoarthritis? First, we'll advise rest and weight loss, local heat, exercises for osteoarthritis like knee exercises or hip exercises. Then go for drugs, that is analgesics, NSAIDs. Then we can give some supplements like glucosamine, chondroitin sulfate, collagen peptide, vitamin D and calcium supplements. We can go for intra-articular injection like sodium hyaluronate, which can be given like a few times a year. And the surgical management will be arthroscopy, osteotomy, and finally joint replacement. What are the complications of osteoarthritis? Most commonly, the patient will be unable to walk. Prevention, weight loss, avoid stress like walking or climbing stairs, avoid squatting or cross-leg position. That's all, Medicos. Thank you for watching and do subscribe my channel to ace the medical exams. Thank you.